Are schizophrenics dangerous? Are individuals with schizophrenia dangerous? This is a question that often arises, fueled by misconceptions and media portrayals. Let's unpack this topic together. Schizophrenia is a complex mental health condition. It is primarily characterized by symptoms such as hallucinations, delusions, and disorganized thinking. A common myth is that people with schizophrenia are inherently violent. This belief is largely shaped by how the media presents the disorder. In reality, violent behavior among individuals with schizophrenia is quite rare. Research shows that while some may display aggressive behavior, it is often linked to acute phases of psychosis. This means that when symptoms like hallucinations or delusions are at their peak, there may be a higher chance of aggression. However, even during these times, the risk of violence remains low compared to the general population. Statistically, only about 10 to 15% of people with schizophrenia may show violent behavior. Some studies suggest this number could rise to 23% if we include threats of violence. But when we compare this to other mental health conditions, such as depression or substance abuse, individuals with schizophrenia are generally less likely to act violently. When it comes to serious crimes like homicide, the numbers are even more telling. In the United Kingdom, only about 30 murders each year are attributed to individuals with schizophrenia. This accounts for roughly 5 to 10% of all murders annually. Most people with schizophrenia are not involved in violent crimes. It is also essential to consider other factors that contribute to violent behavior. Young age, male gender, and substance use have a stronger correlation with violence than schizophrenia alone. Caring for someone with schizophrenia can sometimes involve managing aggressive behavior, but this does not define the disorder. Most individuals with schizophrenia lead nonviolent lives and are often more likely to be victims of violence rather than perpetrators. So, to answer the question, schizophrenia itself does not make someone dangerous. Violence is not a defining characteristic of this disorder and occurs infrequently. Misunderstandings that link schizophrenia with violence contribute to stigma and fear. Recognizing that violent behavior is often tied to specific situations, such as in treated psychosis or substance abuse, helps create a more accurate view of schizophrenia. This understanding supports a more compassionate approach to care and treatment.